Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what the corpus callosum and midbrain are, what their functions are, what can happen if the corpus callosum and midbrain are damaged, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. The corpus callosum is located in the center of the brain at the base, which is the midline of the brain, which connects the left and right cerebral hemispheres, allowing neural messages to pass from one side to another. Similarly, the midbrain is located below the cerebral cortex, being the topmost part of the brainstem and connects between brain and spinal cord. The midbrain is also part of the central nervous system, consisting of three main parts that include the colliculi, the tegmentum, and the cerebral peduncles, having 12 cranial nerves where two thread directly from the midbrain. The corpus callosum is located close to the midbrain. That plays a crucial role in the transfer and integration of sensory, motor, as well as cognitive information. The connections between the hemispheres contain as many as 250 million axons. Additionally, the small structure being the midbrain plays not only a vital function in processing visual and auditory signals, but controls motor movement, pain, as well as sleep and wake cycle. If a person's corpus callosum were severed or damaged, the result would lead to two hemispheres of the brain to no longer communicate with one another. This may also result in dyslexia, a disorder with difficulty in reading due to issues in identifying speech sounds and relating letters as well as words, alien hand syndrome, losing control of the hand and acts as if it has a mind of its own, impaired left visual recognition, as well as left auditory hearing loss, to name a few. Damage to the corpus callosum is a rare condition that can occur within patients with brain injuries while also presenting a variety of cognitive and motor impairments. Likewise, damage to the midbrain results in several complications, including difficulty with vision and hearing, movement disorders, as well as trouble with memory. Due to the midbrain having contained the hypothalamus, it plays a critical part in automatic body functions, which affects body temperature as well as hunger, mood, and blood pressure. On top of previously stated damage in the brain, which results in similar effects, other complications within the corpus callosum that relate to epilepsy include moodism, lack of speech, weakness to extremity, as well as lack of controlling the bladder. Additionally, some children may obtain a change in behavior. With any surgery involved, there is also a risk of side effects that include bleeding, swelling, and even infection during or after the procedure. With epilepsy involved in the midbrain, the brain may result in seizures where the mesial portion of both temporal lobes are. This is extremely important in epilepsy, and it is one of the main sources of seizures and can likely lead to damage or scarring. To treat epilepsy complications within the corpus callosum, a surgical procedure called corpus calostomy can be used to treat atonic seizures, which are also known as drop attacks. Drop attacks essentially divide all or part of the corpus callosum, as the corpus callosum has bundles of nerve fibers that connect the two brain hemispheres, but does not cut through the midbrain. A cut to the corpus callosum to treat epilepsy through the band of fibers of the corpus callosum will disconnect signals between the brain's two halves and prevent nerves from sending seizure signals. However, seizures will occur in the side where it starts after surgery. The seizures will likely be less severe due to only affecting half of the brain, but has a small risk of causing weakness in the arm or leg, which will eventually improve in time. In conclusion, with the corpus callosum being a vital part of the brain function for coordination along with the midbrain of motor movement. Such damage may result in complications such as identifying speech sounds. Despite these complications, it is important to also note how other issues can impact the brain, such as epilepsy. This includes similar effects such as lack of speech and seizures involved. With such complications of the corpus callosum and midbrain, it is important to be aware how the corpus callosum can have a major impact, and especially with epilepsy, altering brain functions. By learning about functions of the corpus callosum and midbrain to the treatments involved to reduce complications related to epilepsy, we can inform or even assist those around us who are struggling to overcome epilepsy. To learn more about the corpus callosum and midbrain, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.